I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, naturopathic doctor. Before we begin today's episode, I want to let you know that today's episode is sponsored by the Confident Clinician Club. The Confident Clinician Club is my online education platform for naturopathic doctors and other integrative and allied health professionals who have goals of becoming not only better educated on how to be an evidence-based practitioner, but who also want to save time in their practice by being given evidence-based protocols for conditions that they see in their patients every day. The Confident Clinician Club membership opens twice per year, with our summer intake happening very soon. If you want to learn more about how to become one of my clinicians and join our group of over 240 practitioners who are learning about the standards of practice and the very best evidence-based protocols for conditions such as miscarriage, PCOS, perimenopause, and others, then I want you to download my free guide, which is about how to navigate PubMed and save you time. It's called our PubMed Hacks. You can find the link to download this free resource in the show notes of today's episode. You can also find us at theconfidentclinicianclub.com, where you'll be redirected to join our waitlist so that when our session opens for this next round of enrollment, that you get one of our coveted spots. Welcome to what is totally a special episode for me for Women's Health Unplugged. It is July 1st, and it is a special day. It's my son's birthday, and he is turning 12, and I wanted to take this day, since it happens to fall on his birthday, to talk about my journey, my own personal journey through fertility, through miscarriage, and then ultimately, finally becoming a mom 12 years ago. And, whether or not you are on a fertility journey, whether or not you've experienced recurrent miscarriage, I think this story is actually pretty important. And it really illustrates, or for me, it became this like springboard for why I'm so passionate about teaching women how to advocate for themselves in their healthcare, why I'm so passionate about a different model of healthcare than what we currently experience, was really my own experience through my miscarriages and then, through my pregnancy. So I wanted to share and tell that story. Now, I've talked about this a lot, right? I've talked about my own personal experience a lot. And so maybe the parts of this story you've already heard before, but the reason I wanted to share it is because I think there are some themes in my story that are probably applicable to yours. So when you're listening, the facts are the facts, right? Around why I had miscarriage, why I, struggled in certain regards. But it's the theme that I'm really after, because these themes I hear in women's stories, whether they are struggling with infertility, whether they're struggling with depression, whether they're struggling with perimenopause or menopause or PMS or any other health condition, that these themes are exactly the same. So my story begins when I was still a student at the naturopathic college, and I sort of accidentally became pregnant, although we all know how that happens, and so maybe it's not an accident, but I fell pregnant in sort of November, December of my last year of my schooling. My partner, my husband and I were both in professional school. We lived in a 550 square foot apartment in Toronto where all the furniture was touching, actually. Like, it was one of those apartments that were so small that if the couch moved by
like a quarter of an inch, you'd be like, whoa, like what is going on in this room? Something's wrong. And then it's like, oh, the couch has moved by a quarter of an inch. We had no money. We had less than no money, right? We'd financed our entire professional schooling, both of us at the same time through loans. I had a really piddly part-time job, which I loved, working at the Big Carrot in downtown Toronto. But the, minimum-ish wage that I was making really just paid for wings and beer once a night on a Thursday night. Was really not making a dent in any of our situation. And I fell pregnant, and we were super excited. The timing was going to be really chaotic for us because I had got pregnant. I can't even remember the dates now, which I see kind of as a positive thing that I've let some of that go. It was in sort of like November, December timeline. And that was going to put a lot of pressure on when I was supposed to write my board exams in August of that year. But we were excited. We were going to have been graduated. Our life was turning out exactly how we imagined it. And the timing was perfect and everything was perfect. And at the beginning of that pregnancy, I did have some spotting. And this is kind of theme number one for this conversation. So I did have some spotting at the beginning of that pregnancy, and I had always had spotting. And so through my entire life, except for a 2-year stint where I was on the Depo-Provera shot, which is the conversation for another day, I always had spotting leading up to my period. And when I was spotting in my pregnancy, it was kind of passed off as, this is you, Jordan. This is your body. This is why that happens. And, this is just you. And so I, was nervous, but also at the same time, I was reassured by the fact that this was something that always happened to me. And so, of course, it was happening in my pregnancy. That's totally normal. And the theme there is really, like, I think it's so common that we kind of get typecast based on our past, right? So, of course you're sad. You always have depression. Of course you have this. You always have this. That's just you. You're a cyst former. We say phrases like this to women, and not just to each other, like outside of a medical context, but we often will talk about these things inside a medical context as well. Your iron's always low. Your this is always that. And where it did a complete disservice to me in my experience, and probably is doing the same for you, is that when we start to normalize abnormals, we stop looking for a reason for why they're happening, right? We stop investigating the spotting. We didn't investigate my spotting ever, and then normalized the experience of it during my pregnancy. And that ultimately became the reason why I was miscarrying, which we really only figured out sort of 4 pregnancies later. So I was spotting in that early pregnancy, and it was over Christmas holidays. It was my father-in-law's 60th birthday. We went to Florida, we didn't go to Florida. We went somewhere in the States. Where did we go? North Carolina over Christmas break. And we golfed, we did all these things, and I was spotting the whole time. And I was nervous. I spent a lot of the time in bed. I was concerned about what was going on. And we finally got home, and I decided I was going to go get things checked out. And just to give you some context of where we were at timing wise, I was around week 11, 12 of the pregnancy. And so I had started to tell my friends. I had started to get super excited because, to me, it wasn't even on my radar that I was going to have an issue, because why would it be? I was healthy. I was in naturopathic medical school. I knew lots of things about health, and yet for some reason, this was happening to me. But anyways, it wasn't on my radar. I started telling people, and I had to go and get an ultrasound essentially to figure out what was going on. Now, at the time, I was living in Toronto, and my family doctor was about an hour outside of the city. I grew up outside of Toronto. My family doctor was there, and the ultrasound clinic was also outside of the city. It was also an hour away. And so I had to drive, and I was in school, so I would like have school, and then I took a couple days off school. I drove, and I had patients because it was like my clinical year. So I'd have to cancel patients and take a sick day from school, which we were only allowed so many before we got in trouble. And actually, it was so inhumane. Like, my husband missed a funeral in our family because he wasn't allowed to miss a clinical day of school. So let's just put that out there, that was not it was not a particularly good time in our life. And so I had to keep driving back and forth. So I drove to an ultrasound that was an hour away that my family doctor had sent me to, and they did the ultrasound, and they were like, "Yep, there's something there, and your pregnancy is only you're 5 weeks and 6 days," or something like that. They said something along those lines, and I was like, "Oh, no, no, that's not what the math says. The math says that I'm at 11-ish, 11 and a half weeks based on where I counted from." And the response to that was, "You're wrong. You've counted wrong. That's common. You've counted wrong." And I didn't know the term gaslighting then, although now that I look back on it, I was like, "Oh, okay, well, maybe I don't know when my last period was. Maybe I don't actually know when we fell pregnant, even though I literally knew, like, the exact day. Maybe maybe I took the pregnancy tests at the wrong time, and maybe they were positive, but like they were so early." I started telling myself a story in my head for why their math made sense and my math did not. So it was January. The weather was horrific. And I went home. I went back to Toronto, and I kept spotting. And again, so I had just started connecting with the midwife clinic, because that's when they kind of take you on, is when you're nearing around that sort of 12-week mark. Back to the ultrasound hospital, back to the hospital for ultrasound, which is where I had to go, and I had to wait like forever and a day. And I go back, and nothing's progressed. And they're like, "Oh, no, you know what? It looks like you have a blighted ovum." And that was it. And so remember, like, I am going to these appointments. I'm driving after clinic to these appointments an hour away by myself, because Sean can't come, because obviously if he can't leave school for a funeral, then you definitely can't leave school to go support your wife at an ultrasound. And I was found out sort of by myself that I was going to have a miscarriage, yeah, or that I was having a miscarriage, and that the embryo had not developed at all. I like fled that ultrasound, and it was at night. I think my ultrasound, I'd gone to the ER for this particular one in Burlington. So I drove an hour away to go to this ultrasound at the hospital, because that's where all my ultrasounds were being done. And it was January, and the weather was terrible. And I left the hospital. I got in the car, and I literally like fled the hospital by myself. I tried to keep it together for this tech who was like, "Nope, you don't have a baby in there." Even though for the last 3 months I thought I was pregnant, and I had told all sorts of people. And so I like literally like fled the hospital. I'm like, "Great, thank you very much. Okay, see you later. Have a great night." Yeah. And drove home to Toronto. So it was snowy. It was gross. I'd hopped in my car. I was driving, and I realized that I hadn't gone to the bathroom after my ultrasound. And I had to stop where it's kind of, we lived at Yonge and Eglinton. And so there's a spot like right around like Yonge Street where there's like, a whole bunch of bridges and all sorts of things. I literally had to like stop. I'm surprised I made it that far, actually, on the side of the road. And I peed into it wasn't Starbucks, it was Tim Hortons. We couldn't afford Starbucks at that time. Who am I kidding? It's peed into a Tim Hortons cup on the side of the road, on the side of the highway in a blizzard. And I wrote about this in my book, and I called my husband. So I was on the phone with him, and peeing into a cup on the side of the road. My cars are like whizzing by. So I was on the 401 in Toronto, which is like the biggest, busiest highway, in a snowstorm and I was like so tense and crying. And I like feel like that this image of myself like was burned into my brain of how alone and isolated and horrible it was. And so I was sent home from the hospital with misoprostol, which is like an at-home abortive medication that you use to initiate or finish the miscarriage. I essentially had a missed miscarriage. And so over 2 days, I had to miscarry by myself at home. And I know many women have experienced that. It's interesting when I was in working at McMaster University. One of my sort of research students actually did research on whether or not emotionally women felt better or worse doing misoprostol versus doing a DNC. It was such a cool project that this girl had done, because we assume that, like, we don't want to be in a hospital and we want to be at home. Being at home and doing it by yourself, it turned out in her research, and maybe things have changed since then. This is 10 years ago. But in her research, they found like equal emotional trauma from doing a missed miscarriage procedure at home with misoprostol than having a DNC in hospital, or doing it at home was just as bad as doing it in the hospital. Anyway, so that was my first miscarriage, and that whole process. And so the themes I want you to pull out from there are, one, that I got typecast, right? Like my situation was really not well looked into, because I got the sort of like proverbial pat on the head. This is just you, Jordan. When really, like, maybe we couldn't have saved that particular pregnancy. I don't think we could have, right? It was a blighted ovum. That was one of those, and I hate this phrase, but that sort of like unviable, not meant to be pregnancies. There was nothing that could have been done for that particular pregnancy. However, if we had spent some time learning about that pregnancy, or put more effort into that pregnancy, then my subsequent two miscarriages probably wouldn't have happened. But I was sort of typecast, and it was like, this is just you. And we didn't look into it. And my entire sort of passion around treating and supporting women with infertility has been, look, if you are talking to anybody about your fertility, or if you're sitting in a fertility clinic, those reasons why you're there, even if it's kind of unexplained and we haven't quite figured it out yet, those reasons why you're there increase your risk of miscarriage. My gynecological symptoms before getting pregnant increased my risk of miscarriage. And yet it was just passed off as like, we don't know why you spot, Jordan. This is just you. And yet that became the sole reason why I miscarried 3 times. And we had just never looked into it. So I don't want you to get passed off as, this is you. I hate that phrase. This is just you. Because there's something for us to look into. We need to be curious enough and interested enough to look into the reasons why women have their symptoms, because they're not isolated. They show up later in your life, especially gynecological symptoms. They show up in your fertility story. So I want you to have them looked into. I mean, the other thing that was just horrible about that experience is how cold and medicalized that process was. And I've used this phrase before, but to me, I didn't feel like I should be sitting in an ER, wondering if my baby is alive, sitting beside some kid who is puking in the ER, right? Like this is how we treat women going through emergency gynecological situations, is that you're like, bleeding out on a gurney in a waiting room full of people, and they're there for other emergencies, right? Like, it's like dude with a broken arm, and then there's me having a miscarriage. And I'm not saying my case was more important. I'm saying the sensitivity that is required to support women going through a gynecological emergency is just not there. And the whole experience of the nurse was like, no, your baby's dead. Like, that was really, really traumatic and difficult for me, especially since I was alone. And it's made me think, like, through the last year of the pandemic, where so many women are going to appointments by themselves. Women gave birth by themselves, for God's sake. And it made me think of those moments, right, where I was by myself and I just had to like bear this brunt of all of this news alone. And then my poor husband at home, like waiting for me to call to find out what's his future looks like. It was very traumatic. And we struggled afterwards, for sure. Both of us did. It was a very traumatic experience. And part of it's because we thought we were pregnant for so long. And one of the ways that I've described the grief around miscarriage is, typically when I had always thought about grief, it was grief for something that had happened in my past, right? Like I lost someone and it was sad and I missed them and I missed the past. For me, the miscarriage was grieving a story or future that I had imagined in my head that suddenly got taken away from me. Up until that point in my life, I had achieved all the things I wanted to achieve. Of course, there were jobs I didn't get and that kind of stuff, but nothing that was like felt so life altering. And in those 11 and a half weeks that we thought that we were pregnant, we had rewritten our story. We'd rewritten our summer. We had started looking at where we were going to live and what practices my husband was going to work at and how I was going to manage writing my board exams while I was pregnant. We had rewritten our future to include a person and a story about how we were a mom and dad. And then that was suddenly taken away. And we went back to our 550 square foot apartment and my crappy little job, which I loved. But the moral of that was we went back to the life we had before, which was great. Our life was great. And yet there was so much grief about having to go back to it. So no, our life was not terrible. We just went back to that life. And so on paper, you would imagine like, yeah, it's fine, Jordan. Like you just went back to your life and you carry on. But we had lost something. And that's, we lost the future that we had created in our minds. And that was kind of the best way I could come up with describing what the grief around miscarriage was that we had changed, even though it was only 11 weeks or so that we knew that we were pregnant. So fast forwarding through that year, it was difficult for me. I had to go back and tell all my friends that I wasn't pregnant. And 99% of my friends are guys. And so that they're lovely and wonderful and supportive. And yet that was different for me. I didn't have a lot of super close girlfriends, growing up or at that time in my life. And we just carried on. We just went back to school and kept going. I did fall pregnant another time. And miscarried. And that one happened in the summer. So I didn't get my period back for a long time after that miscarriage. And again, very normalized. It took me a long time to get my period back after the pill, an even longer time to get it back after Depo-Provera. Again, episode for another day. And it took me a long time to get my cycle back after the miscarriage. I think it was 5 months. So this was January that I had miscarried. And then February, March, April, May, June, I got my period back. And then I got pregnant again. So literally like every single time I ovulated for 9 months, I got pregnant because I had so much delay in between every cycle. So I fell pregnant again. And this was as I was studying for my board exams. So I graduated and I was studying, like it was my full-time job to study essentially. And we still lived in Toronto. We still lived in the 550 square foot apartment, which I kind of miss sometimes actually. And I was studying all the time for my board exams. Like this felt like I was like full steam ahead. I am going to pass my exams and I am going to become a badass naturopathic doctor because I'm not having a baby apparently. And I fell pregnant again. The very next time that I ovulated, which was in the summer. And we were super excited. And it was right before I wrote my board exams, actually. And we were excited. We were like, okay, this is it. This is the one, right? This one will work. This one will do differently. And yet we didn't do anything differently, right? Again, thinking back to my sort of typecast experience, we didn't do anything differently in that second pregnancy. And I miscarried the week of my board exams. So I miscarried, like I was still bleeding when I went into my first written portion of my board exams. And that one emotionally was not as bad. And part of it, I think, when I think back to it, it's probably because it just couldn't be, right? It was like if I was in a survival mode, I remember telling my little study group, I studied with 2 or 3 people. I told my study group that I had had a miscarriage. And yeah, that that was it. It was like, oh yeah, I had a miscarriage, and like, let's go write our exams. So I kind of even skip over that one in the story or in my mind because it wasn't particularly useful or helpful. And what should have happened really after the first one is I should have had some kind of assessment done. So if you imagine like between February and June, like literally nothing happened in my health, and no one looked into me. I didn't have any doctor's visits. The midwives were like, okay, that's fine. You're not our patient anymore because you're no longer pregnant. My family doctor, who I didn't have an amazing relationship with because he thought I was silly for going to naturopathic college, he told me that a lot of people get hurt with that kind of medicine. Um, and so I really didn't have anyone on my healthcare team at that time. So I skip over the second one in my mind. And then the third one, we had fell pregnant very quickly after the second one. So it was like I had my board exams and then we moved. We moved from Toronto to Burlington outside of the city. And we moved into a slightly larger apartment, which was great. Not all the furniture was touching. And I fell pregnant again, like the very next month. And I think with that third pregnancy, I was pregnant for about a minute. Like I got a positive pregnancy test and then I started bleeding and had a full period. And what I learned from that particular pregnancy is that if you're pregnant for a minute, nobody cares. And not just like people around me who were like, "Oh, that one really wasn't meant to be, Jordan." But also in medicine, we really didn't care. So if you don't know, the rules for investigating women with miscarriage is that you have to have had 3. Now, if you're pregnant for like a day, do we count it? And that's really what the argument became with my practitioners is I was like, okay, I've had 3 miscarriages in a row. And that third one was the week that I got my board exam results, which I passed. But the stress of waiting for that letter, because they literally like mailed you a letter, the stress of waiting for that envelope was really significant at that time. But we people barely counted that third one. And funnily, like I think I was becoming emotionally numb to it too. I was like, "Oh, there we go. Nope, didn't work again." And move on. And yet it really should have been counted as far as like us thinking about how we're going to support my health, right? I really should have had some testing. My husband should have had some testing done. We should have had some kind of investigation into what was going on, but that was not part of the conversation. So we did what any couple does when they have 3 miscarriages and they buy a dog. And so we bought a dog. And it was it was like the end of the summer and we had had 3 miscarriages and so we got a dog. And I loved it. The dog was so great. He was a bulldog, an English bulldog named Tank. And that's why we got him because we were like, okay, we have infertility. We are not having a family. We'll get a dog. And when I try and think back, and I have to say try because I honestly feel so emotionally detached from what was happening during that phase of our life, I don't really think it was sinking in at that time that this was never going to happen for us. I really wasn't thinking. I was trying to just focus on my career. I was trying to focus on staying afloat. We had graduated from school with like, I don't know, $250,000 in debt, in student debt. And it was like, okay, we're not going to have a family. We're going to get a dog and we're going to work like crazy people. This was what we had decided. So we started our careers and that's what the goal was. And yet, somehow, and I don't really know how, because I really did not feel super supported in the 4th pregnancy. Somehow I got my wits about me when I fell pregnant the 4th time. And I was living close to my family doctor, and I marched into his office and I was like, we're going to do this one differently. I was like, because now I had been researching it, I want progesterone. So if you remember, I'm going back over the timeline, I was pregnant 4 times, and this was now September. No, it was like late October, November, that I had fallen pregnant again. I was like, I want progesterone. And my family doctor was like, it doesn't really help. And I was like, I've been pregnant 4 times in 9 months. I'd really like to try this. And that was a long time ago. So it's 13 years ago. However, our use of progesterone, our understanding of it, I'm not saying you can get it in a vending machine, but I'm saying it's relatively easy to get progesterone now. But at that time, and there is some relative parallels for what it's like for women who are struggling with miscarriage and infertility now. But at that time, I was basically asking him to work outside his scope of practice and give me a harmless medication that might prevent a future miscarriage. And he didn't really want to. I really, really, really had to advocate. I got, a low dose. Looking back now that I know what I know, it was a very low dose. It was sort of like a, backhanded prescription. Like, I guess so, if you really want to. And I finally went home with a prescription in my hot little hands that I had to get compounded to try and help prevent a miscarriage. And I did the progesterone suppositories. I still spotted for my entire pregnancy with my son. And it was really traumatic. Every time I spotted, because I was crying essentially, which meant I was crying like about every day and a half. But I achieved it. We did it. And it was really only because I finally looked stuff up. So between that third and fourth pregnancy, I was done school. I was not as stressed. I had a cute little dog. We were, focused on our career, but I also was looking stuff up. And this is the part that kind of like is interesting to me, is that even as an educated woman, even as a woman who has a background in medical research, literally my superpower is figuring out what the research says about medicine. I never looked anything up in that first, second, and third pregnancy. I handed over all of the responsibility of my health to an ultrasound tech, to my family doctor, to the midwife clinic that I never even walked through the door of because I didn't get that far in any of those pregnancies. I literally handed over all of the responsibility to others. I was like, I'm going to be taken care of in this moment. And none of those people were curious about what was going on with me. None of them wanted to spend the time to figure out why I was spotting. None of them even offered a lot of condolences after I'd had the miscarriages. And it made me realize that there is such a need and role for practitioners to support women during not just this time, but like all parts of their health. But it took me going into PubMed and researching the shit out of miscarriage to be like, well, the next step would be for me to have progesterone. And then going into my doctor's office and fighting for a prescription that he didn't want to give me in order for me to have my son. That's what it took. And that sparked in me this, I don't know if I call it anger. I don't know what the right emotion word is, but it sparked this fire, we'll call it, in me that I was like, this happens everywhere. This happens in many scenarios. This is in every woman's story when she goes to the doctor, that she gets typecast, that she goes in with information and her doctor tells her it's crap, that she, has a story that no one's even bothered to ask what the story is. We just, want to get it over with in 7 minutes and treat her and give her a thing and send her home with a piece of paper or without, and pass her off onto some other specialist or some other doctor who's going to do the follow-up appointment. Like, this was happening everywhere. And it's partly what sort of has driven me to want to create accessible, evidence-based information for women, because I think we get frustrated when women have gone and Googled things. Like, as healthcare providers, it's not easy, I'll tell you. When people are like, well, Gwyneth Paltrow says, or I read on, this website that. But we have to remember the root of why that's happening, right? Women are looking stuff up because they don't feel supported. They're looking stuff up because they didn't think you listened to them in those 5 minutes. And so they go home and they look stuff up. I just so happen to have the skills to look up I'm not going to say the right thing. That's not the right word. I have the ability to go look up the evidence-based next best step. But not every woman has those skills, right? They did put all their trust in that doctor. And when they don't feel like they're getting what they need, they go home and use the skills they have. And the skills they have bring them blogs, bring them newspaper articles, bring them information that is maybe not particularly evidence based, but it's something, right? And it's more hopeful than what they felt like they were getting when they left their doctor's appointment. So I fell pregnant. So I got pregnant and I stayed pregnant. I made it all the way. I spotted through my whole pregnancy. I had a boatload of ultrasounds in order to try and assess what was going on with this little baby. And he was fine. And he was born at home on Canada Day in what was like at that time one of the busiest days of the midwifery practice that I worked with. I met my midwives, or I met the main midwife who delivered my son while I was in labor, because it was such a busy day for those women that both of my midwives were at other births when my son came. And he was a little bit early, so that was part of the problem. And it was such a lovely and wonderful experience. And I would not have had that if I hadn't been such a stubborn ass woman to ask for the treatment that I needed in order to get pregnant. I believe that like deeply in my soul. And I know when we look at those other pregnancies, we could probably go, well, they weren't related to low progesterone, Jordan, or those ones were maybe not viable. And then the fourth one was, or you were super stressed. And then on that fourth pregnancy, you had 900 square feet in your apartment and a dog, and, you know, you weren't in school grinding it out. Like all of those things are probably true. But the biggest difference between those other three pregnancies and my fourth that was successful was that I drove the bus. I demanded care. I said what I wanted. I took control. I stopped letting other people tell me what to do. I stopped expecting to be cared for. And I was the one who ran the show. I was the one who did all of the work and insisted on what my care needed to look like. And so that's why I was successful, I think. That's when I look back on that whole experience, that's why things were different with Parker's pregnancy, is because we changed things. The themes that I want you to pull out of that story, and we'll talk about my second pregnancy in a sec, but the themes that I want you to pull out of that story is that, one, your story really matters. So like I said, this sort of like typecast experience is a problem for me. You're a spotter, right? Well, if I'm a spotter, we had evidence that I had low progesterone starting back when I was like 20. So why didn't we let me have multiple experiences unsupported when that signal that I needed progesterone had been there my entire life, and yet we ignored it, right? Also that you are the center of your healthcare, right? You are the one that needs to feel heard, to feel supported. And now I will say that yes, for progesterone, we give way more frequently and way more liberally than we did before. But there are other examples of this in not just fertility care, but in other care where we, like, physicians end up being the gatekeeper for some treatment options that women can't get. I think of things like spironolactone for acne. I have a hell of a time getting people to get a prescription for what we now know to maybe be the very best option for supporting androgen-driven or testosterone-driven acne. I feel like I have to do a special dance, and light myself on fire in order to advocate for my patients to get a prescription for this medication when the evidence is really clear that it's the best choice. And so that was my version of it 12 years ago or 13 years ago. But there are versions of this story happening in medicine right now where we don't listen to a woman's backstory, and yet it gives us every single clue that we would need to know on how to treat her. And we gatekeep the treatment options that she may benefit from because we fail to look at each woman as an individual. And we say, well, this is not what we do, right? You don't get progesterone for your first pregnancy. You have to have 3 losses before you're allowed to have progesterone. And so I want to change the culture of that. I want to change the culture of how we treat fertility, where we listen to your story before you try. We think about you before you have loss. We listen to your losses to change our strategy. That's what needs to happen in order for us to have better fertility care. And probably that's what we need to do to have better care in women's health all over the place, or in every facet of women's health. So today is a special day for me. It marks not only when I got to meet that kid, who is such a cool kid. I'm so grateful and lucky to have him as my son and for me to be his mom. But it also marks like this like real anchor in my own personal story for why I'm here, right? Why do I podcast? Why do I write? Why do I show up for patients? I honestly believe that it started with that experience for me, because now as I've moved through my own health journey and have had to advocate for various things that maybe fell outside normal scope of practice, that maybe were unique, that maybe I felt I wasn't heard, I've leveraged that experience for myself, and I leverage it every day for you so that we can move the needle forward on your health too. That's essentially how I view that experience. Now, my daughter just showed up out of nowhere. My son was a really tough baby, and he like had not slept. I think he'd slept like 5 times for 5 or 6 hours by the time we got to 14 months. So when he's 14 months old, he had slept for 5 or so 6-hour stretches. It was a very, very tough year. So topic for another day, but like how you struggle with infertility and then you resent your baby. That is a difficult transition to make. You feel a lot of guilt when you resent the baby that you wanted really badly. Anyways, it was a tough year, and we had slept through the night, or slept for 5 or 6 hours, and had our wits about us, and we had started talking about maybe having another baby, which I joke that someone should have slapped us across the face in that moment. When we started talking about maybe having another baby, and I was going to get ready to start tracking my cycle, and my cycle never came, and I was already pregnant with Charlie. And so she just, presented herself, and I did go get progesterone. So the moment I found out I was pregnant, I went and saw my doctor again, asked for progesterone. Again, he said it probably wasn't going to make a big difference, even though that was the thing that maybe had helped me have my first baby, who was in a car seat beside me on the floor when I was asking for progesterone in my second pregnancy. But I was pretty over him at that moment. And so I was like, okay, whatever, just give it to me. And shortly thereafter changed family doctors, which is not an easy task to do in Ontario, Canada. But besides the point, my daughter showed up unannounced. And so when I think about, my whole journey with fertility, obviously I get pregnant very easily, right? And both of my pregnancies that were successful required progesterone. Does that mean that that was why I stayed pregnant? We'll never know, right? When we look statistically at women who have recurrent loss, women who have unexplained miscarriage, women who are going through any other kind of fertility procedure, the statistics suggest that progesterone is making a remarkable difference. And so I'm going to lean on that and say, yes, it made a remarkable difference for my life and for my family. And I now have 2 beautiful kids who are 10 and 12 because of my own personal advocacy for being supported early in my pregnancies. So when I think about what I want you to take home from this episode, I mean, one, it's nice for me to share my story. It's kind of cool on this day to think back to what it took for me to have him. And I have deep empathy for all of my patients who are moving through a fertility journey, because I lived it, right? I walked through all of those losses in a very difficult time in my life. Like that clinical year of school and that time of our life living in Toronto and, all of that, that was a difficult time without layering 3 miscarriages on top of it and feeling so alone and all the driving and all of that. So I have deep empathy for what that
experience is like for you. I lived it, I walked it, and now I work with women every day who are walking through that experience. And I will say that approaching those patients with curiosity, with the willingness to listen to their story, their medical story, and their personal story, to be creative, right? There are aspects of fertility that do require some level of creativity. And I don't mean like, okay, take this special potion kind of creativity. I mean, there are reasons that women struggle with fertility and miscarriage that we don't quite understand yet. And so listening to the themes of your story, whether it's allergies or autoimmunity or bleeding or PCOS or endometriosis, we have to listen to those themes of why women are struggling, not just with fertility, but with their health in general, and be willing to be progressive and creative to help get them solutions that are going to perhaps change their outcome. Because doing nothing and trying again is not a solution. And that was the solution that was presented to me. Try again and do nothing different, right? There's lots of quotes about that and how we feel about that. So that's what I want you to take away from my personal story. And I'm excited and happy to share it with you today, being July 1st. And I want to say happy birthday to Parker. And I have like the biggest like goofy smile on right now. I'm so grateful that I had that experience and that I was able to pull through, because the world is a better place with my son in it for sure.
I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.